everyone, my name is Areeba Muhammad Ali, and today I'm going to present my undergraduate research, which I did for the completion of my BS degree program under the supervision of my teachers, Dr. Sadaf Ahmed and Dr. Fizar Mirza. So, the title of my research is Non Pharmacological Auditory Intervention for Sleep, a Psychophysiological Comparison in Shift Workers. So, let's talk about the background of my study. Night shift is very common in people in our society. For example, if we talk about our healthcare society, like doctors and nurses, the majority do night shift. And not only healthcare, but in security as well as in industrial areas, many people do night shift. This night shift causes the disturbance of our circadian rhythm, which normally controls our sleep-wake cycle. So, due to this disturbance, our sleep difficulty occurs, and sleep duration becomes less, and our mind becomes exhausted, and our sleep quality also becomes poor. And eventually, these problems causes our cognitive function. It affects our cognitive function as well as our attention, memory, and physical and mental health. It affects these all. So the researchers mainly focuses on non-pharmacological interventions because these are safe, non-invasive, and low cost, and they don't have any kind of side effects. In this, the most important method is the auditory relaxation, in which we listen to nature sound, and it relaxes our body and it makes our sleep better, and it overall relaxes the body. So this relaxes the body and helps to get the better sleep. Okay, so after that, I would like to discuss the objective of my study. So the objective of my study was basically to evaluate how nature sounds affect the sleep quality of night shift workers. Do they really have effect on their sleep quality? Like, do they improve their sleep quality or not? So this was the main objective of my study. So now let's talk about the methodology. My research was it was randomized control trial, and total there were 30 participants, and we chose night shift workers for this. And my research was totally of 2 weeks duration, and the people were under 20 to 40 years old. The night shift workers which we chose for our study were under 20 to 40 years old. Okay, so now the participants were randomly divided into two groups. Number one was the intervention group, and the one was other was the control group. In intervention group, 15 participants were included, and they listened to nature sounds before sleep for 20 minutes. For 2 weeks, like before their sleep, whenever their sleep was scheduled, so they used to listen the nature sound which we provided them. For example, nature sound, if we talk about nature sound, so there are a lot of nature sounds like forest sounds, thunderstorm sound. Like these sounds calms the body, calms our mind. And there are a lot of music like classical music, but we chose nature sound as an intervention for the participants. And the other group was control group. Control group did not receive any kind of intervention. We just uh, let them to fill our forms before and after the intervention period, like before 2 weeks and after 2 weeks. And in intervention group, participant listened to nature sound for 20 minutes, and we provided them nature sounds. Now let's talk about their sleep quality assessment. So we assess their sleep quality using two scales. Number one was the PSQI, Pittsburgh Sleep Quality Index, and number two is SQS scale, Subjective Sleep Quality Scale. By using them, we assess our participants' sleep quality, and the measurement were taken before 2 weeks and after 2 weeks, after 2 weeks duration of both groups, intervention group and the control group. And these are questionnaires. These are basically questionnaire which have many kinds of question according to the sleep. So we use them for their assessment. We also used participants we also provided them post intervention form in which we got to know about their experiences that they experienced during the 2 week intervention, and then they fill out according to that. So now I would like to talk about the results. So the intervention group showed significant improvement in their sleep quality. For example, the PSQI scores decreased from 8.13 at baseline to 5.87 after the intervention period. And this indicates the better sleep quality, and it also indicates that they had showed some improvements in their sleep quality. And if we talk about the control group, so there were not any significant changes, any like minimal changes were occurred due to some changes in their normal routine as they did not get any intervention. So, the results of my research study suggest that nature sounds reduce the stress of our participants, and it promoted the better sleep quality. Because the better sleep quality was observed in them, and when we asked them to fill the post intervention form, so they also showed their positive comments to the intervention which we gave them. And in the SQS sleep quality index scale, so not any significant changes were observed. So now I would like to conclude my research that nature sounds showed great effects and on the night shift workers, and they are simple, low cost, non-invasive method for improving the sleep quality of the night shift workers. So they can use this intervention in their daily routine, as it has not any kind of side effect, because it is non-pharmacological intervention. So this does not have any kind of side effect. So that's it, and it was about my research. So thank you everyone.